Hi, my name's Miranda, and today we will be talking about tobacco use and why your company should invest in a chemical dependency program. The marketing method I'm using is the needs satisfaction method. This method consists of 3 stages. The first stage is the needs development stage. This is where we are identifying the problem that the customer would like to solve. I have a figure here from the Center of Disease Control and Prevention that goes over how different age groups have attempted to quit smoking, and this was from the year 2017. So the age group of 18 to 24, 66.7% had attempted to quit. 25 to 44, 59%, 45 to 64, 49%, and 65 and older was 47%. All of these numbers indicate that about 50% of individuals have attempted to quit in 2017. Of that number, we have here the smokers who successfully quit that year. All of these numbers are below 10%. With less than 10% of any age group showing success, we see a need for intervention. The next stage of the needs satisfaction method is the needs awareness phase. This is where we look to see if the customer recognizes the same needs as the salesperson. As the salesperson, I need to know what motivates the smoker to quit. The most common reasons include financial benefit and health. In these figures here, we have reasons why an individual might like to quit smoking for health. Here, we have a time lapse of how the body reacts to the lack of cigarettes. 20 minutes after the last cigarette, both the heart rate and blood pressure decrease. 8 hours after the last cigarette, carbon monoxide levels in the blood and oxygen return to normal. 48 hours after the last cigarette, then we see nicotine no longer in the body. 2 to 12 weeks after smoking cessation has begun, then breathing will begin to improve and exercise will become easier. 3 to 9 months after the last cigarette, then the lungs will begin to repair themselves and again breathing will improve. 1 year after the last cigarette, then the risk of coronary artery disease decreases by 50%. Here we have additional benefits to quitting, and those benefits include the decreased risk of cancer, decreased risk of chronic obstructive pulmonary disease, and fewer instances of reproductive health outcomes as a result of smoking. Positive outcomes of not smoking include an increase in quality of life and an increase in life expectancy. Moving on to the last stage of the needs satisfaction method, we have the needs fulfillment stage. Here we determine how a program can assist a smoker in quitting. So a chemical dependency program offers both specialized support and medications that help an individual quit. This method has shown substantially more success than any other method. In this figure here, we have a comparison of successful ways to stop smoking. The methods showing the least success include quitting cold turkey and the use of nicotine replacement therapy without professional support. A method that has shown some success, but definitely not as much, is the use of e-cigarettes. E-cigarettes show 60% more success than either quitting cold turkey or the use of nicotine replacement therapy. Now, speaking of specialist support and medication, this method is 225% more successful than any of the other methods discussed. A chemical dependency program would be a useful addition to company, and the smokers working for your company would benefit. I would like to add 2 alternative methods that can be used to market a product. The first is the stimulus response approach. This method is based on research by Ivan Pavlov. He recognized that a natural response is produced after repeated exposure to a stimulus. In marketing, his findings are applied to canned presentations. A script can be used to plan a message that leads a customer to a certain product, in this case, a chemical dependency program. Questions often have an obvious answer. An example would include, do you want to live the rest of your life with an addiction? The second alternative method is the selling formula. The selling formula includes 4 steps before a customer buys a product: attention, interest, desire, and action. The salesperson gains attention by engaging in conversation. This step would include discovering what the customer knows about tobacco use and if they currently use the substance. The salesperson would then establish an interest in the chemical dependency program by asking if they've ever thought about quitting. Desire can be established by educating the consumer on the benefits of quitting that they did not already know. Action is the final step for the salesperson. This is where they would provide information about the program and how to start. Of the 3 methods described in this presentation, the needs satisfaction method is the most customer-friendly and flexible. For these reasons, the primary focus of the presentation was on the needs satisfaction method. Thank you for watching my video presentation. I will now show you a close-up of the images and figures shown on my video. The 2 images on the screen were collected from the Center for Disease Control and Prevention. On the left, we have the smokers who made quit attempts in 2017. The smokers were divided by age group, and you can see that the highest percent of quit attempts came from smokers 18 years old to 44 years old. The image also shows the percent of these smokers who successfully quit in 2017. On the right, we have health benefits for smoking cessation. The benefits include improved health, improved life expectancy, lower risk for diseases such as cancer, cardiovascular disease, COPD, it lowers the risk of poor reproductive health outcomes, and other benefits include improvements for individuals who already have a diagnosis of coronary heart disease and COPD. It also has shown evidence that people who smoke for years can still benefit from quitting. This figure was collected from the International Society of Substance Use Professionals. It shows a timeline of the benefits of smoking from 20 minutes to 1 year. The benefits, as I previously discussed, include heart rate and blood pressure reductions, carbon monoxide levels in the blood decreasing, and oxygen levels returning to normal. Mucus and debris caused by smoking begins to clear out. Nicotine no longer in the body, breathing improvements, lung repair, and a decreased risk for coronary heart disease. Last but not least, we have this image from the Cancer Research United Kingdom on the most successful ways to stop smoking. You see that cold turkey and nicotine replacement therapies show the least success. More success comes from e-cigarettes with 60%, but ultimately support and medication have the highest level of success with 225% more success. The chemical dependency program would offer these services, making it the best option for an individual who is interested in smoking cessation. Thank you again for watching my video. This is Miranda Moore.